my dream to have my own health center that was nurse-led. I went over to Abbotsford Homes and I met with the Abbotsford Homes Tenant Management Corporation, led by Dorothy Harrell, thinking I was going to get shot down, and what they were going to say is, why are you offering us nurses? You always give us the short end of the stick. Why not physicians? To my surprise, Dorothy Harrell looked at me and looked at her colleagues and very, very slowly said, in my estimation and in my experience, it is nurses who do the caring, and this community needs caring. So that was the beginning.
In this time of economic uncertainty in America, we become aware of more and more disenfranchised people who have had and lost insurance, or people who have insurance and are afraid they're going to lose it and don't have the economic resources to take care of it.
So we are providing services to some people that really come from what we consider underserved communities. There are really no hospital systems down here. And for many,
I have spoken in statewide conferences and national conferences, and when people find out that we have this integrative therapies, dental, primary care, behavioral health, legal, medical, and mind-body all in one location, it just blows their mind. They're not used to that, and it's a very, very
inspire them. I love working at FPCN because of the integration of services that we have here. Being able to provide patients with a lot of services all under one roof is a blessing for many reasons. And so I believe that our framework is a holistic framework, and that
I was looking for a place that I could go where I would be able to work with people that had health disparities that maybe wouldn't be addressed at a typical facility. So that was one of the reasons why I came.
We need to be able to be there under any circumstances for all of our patients, regardless of their ability to pay, so that their overall health will improve as the health of the community improves at the same time.
One of the great things about working for FPCN is that it really has a family atmosphere. More than that, we work as a team together. If you have an issue or a problem, they help you figure it out. They help you get coverage if you have to go somewhere. If you have a question about a patient, there's someone you can ask, and it's more about helping the patient and getting to an answer and delivering quality patient care and making that accessible to everyone. No one on the team is more important than the other. We have social work, we have nurses, we have nurse practitioners. We're really here for the patients, and that was what I was looking for when I was looking for a job. I wanted something where I would feel like I was part of a team, part of a community, and I got that working here.
I had a health issue that was making me crazy. I went to several other places, hospital, other doctors, all in your head, all in your head. But when I came here and we got right to the core of what was going on. If you see a little tear, I get emotional. I am serious about this place. That's when my healing began. Every time I think about that, it just brings so much peace. And why I say peace, because I didn't have it until I came here. And peace within means a lot, and you will get it here. Once you tell them your story, what's going on, then I promise you the healing will begin.
Community engagement for me reaches far beyond the walls of medical facility or health center. It's knowing the nuances of that community, and of course the patients that we serve make up that community. So we need to know who they are. We need to know their language, literally and figuratively. We need to know their values. And you get that by community engagement, by not just limiting our contact with them to their physical visits, their annual checkups. It's one thing to want to know, how much weight a patient gained or how they're doing with their dietary habits, how's their blood pressure. But it's also important to know what's going on outside in their lives and their families and what